Hi, my name is Nyleen Flores, and I'm the CEO of MedElevate Solutions. So we're a consulting firm where we streamline processes to amplify and increase outcomes, positive outcomes, and that includes financial, streamlining processes, to streamline workflows, and just help facilities get better, do better, and have best practices implemented in their facilities. So Palmetto Lakes is a multi-specialty surgery center out of Miami, Florida, and they have serviced the community for almost 20 years, 30 years, I believe. And they have GI, pain management, orthopedic surgery. So it's a full-on 4 OR surgery center serving the southeast of Florida. So we met with Palmetto about, 15 months ago. We started discussing where they had some areas for improvement. Particularly, it started with billing and revenue cycle management, and they wanted to get a recommendation of different softwares and different revenue cycle management companies, processes, quality improvement initiatives. And so they engaged me to be able to assist them to basically revamp their process, take a look at everything, provide an objective review to help them basically streamline their processes and optimize their general revenue. And so that included implementing electronic processes, which begin with obviously practice management implementation and then EHR implementation. And that's when I introduced them to the options that they had available, including HST. And that was about a year ago. We had to evaluate and do the pros and cons of obviously pricing, but also bundling of services. So we wanted to ensure that we chose a product that could accommodate all the different specialties and the processes that we wanted to implement as best practices for Palmetto Lakes. So we've been extremely successful in doing that. And so HST was able to help us and implement all the different aspects and products available to us so that we can provide a one-stop shop solution instead of breaking down different aspects. Their workflows have changed from registration to check-in all the way to discharge, and obviously throughout the entire revenue cycle management system process has completely changed. Record keeping, accurate reporting, facilitating, streamlining processes, everything has pretty much been streamlined and improved. And so we are, especially when it comes to reporting and holding people accountable, it's been phenomenal. So we've definitely seen improvement in streamlining across the board. Absolutely. So they've been able to streamline their staff and basically have time count more efficiently. And we've been able to improve cost savings and help the facility be more organized and report on time, have actionable and basically measurable outcomes because there's actual data that doesn't have to be gathered by hand. So it's a very big time saver. And then overall satisfaction for the staff that they have a platform that they can go and log into and see everything that they need to see in one place. So feedback is obviously implementing a new software is sometimes overwhelming with the staff. So I remind the staff to just take a minute, let's take a breath. This is to make your life easier. I understand it may seem overwhelming, but actively engaging the staff in the process has actually been really helpful. So once, like, for example, the nurses see, listen, I want to make this work for you. And I have a one-on-one with the nurses and say, okay, let's go step by step. Tell me what you want. It's okay. If you don't like it, let's change it. And giving that empowerment, not telling them what to do, but actually assisting them make the best outcome for them, shows them like, oh, this software is for me. Like, I have a say in what I get to do. And so that has made them be a little more receptive to change, because change is hard. And we know that especially going from a paper process to an electronic process is very, very difficult sometimes. But keeping a positive attitude has assisted, and so little by little they've come around and they've seen the benefits in all the changes that we've made. We're still in the final stages, I'm not gonna lie, because in Southeast Florida we are very bilingual. So there's staff that speak primarily Spanish, so there's a little bit of a language barrier, and training has to be done in 2 languages. So that does have its drawbacks. Also, in a surgery center, we have a lot of people wearing one hat. And so we know that it does take some time. So that's why partnering with us at MedElevate, we've been able to help them and just finalize, really putting the final touches into going live. It's step by step. It's a lot of hard work from the staff and engagement from the staff. Support from administration has been invaluable. I've had a great partner with the administrator there and the owner of the practice. So the medical director has been phenomenal. So that has definitely made a difference. So it's been a lot. It's been a step-by-step, and we're almost done. Looking to implement case coordination is the last bit to engage the community into the new processes. As of right now, they've pretty much implemented everything that we've recommended to help them, and they've seen the value in products, for example, like Clarity. They've seen the value in bringing those types of things into the center. So I'm looking forward to implementing case coordination and getting that, like I said, that final step into there to engage then the outside community to be partnered now with Palmetto to help them grow. Absolutely. I would definitely recommend. It's a very easy to use system, and it's very customizable to each center and personalize it to what you need as a center. My favorite thing I will say that when I tell people about HST is that it works the way a nurse's brain works. And a nurse's brain works step by step because they don't want to miss anything, and they want to make sure that they do things in an orderly fashion, which they need to do in order to keep patients safe. So HST, working in a linear fashion, in other words, step by step, allows them to work in the way and with the nurses instead of the nurses trying to figure out, where do I got to click over here and what do I got to do over here. It helps them keep a very orderly process and helps them be very engaged. Also, allowing the facilities to manipulate and update the system as much as they want is extremely helpful because things can be updated at any time. So that is what I love about HST.